Hello everyone, you're watching PhysioClassroom channel, and in this video we are going to learn the manual therapy skill to perform the knee joint circumduction mobilization technique. A therapist can utilize this technique to break adhesions in the knee joint and improve the knee joint flexion and extension ranges. So let's get started. To perform the circumduction mobilization technique, make the patient lie down in the supine lying position in such a manner so that at least half of the leg is cleared off the treatment couch. So this is going to be the starting position for delivering the circumduction mobilization. Now from here, the therapist is going to first abduct the treatment leg so that the knee is actually cleared of the treatment couch. The knee is going to be flexed to about 30 to 35 degrees, and the distal leg and the ankle region is going to be stabilized between the distal thigh of the therapist. Next, the therapist is going to anchor the proximal tibia by wrapping both the hands over the tibial condyles just distal to the knee joint. And with this position maintained, the therapist is next going to shift the body weight backwards in order to produce the distraction of the knee joint. And without losing this tractional force, the therapist is next going to apply circumduction to the tibia and thereby enhancing the motion of the tibia in the three-dimensional space. After performing this for around 30 seconds, the therapist is next going to take a break and then again take this into distraction, and this time going the other way round. So this is a very wonderful technique. The therapist can also progress. Let's say for example, the knee extension range is limited. So every time I am going to go down, I am going to decrease or improve the range of knee extension. And then again with the next repetition, more extension. With the next repetition, more extension. The other way around, if I want to improve flexion, every time I am coming up, more flexion. I am coming up, more flexion. So this is a very nice way to improve the joint ranges in the knee joint. So this was all about the practical demonstration for the knee joint circumduction mobilization technique. Do try this on your patients and provide us your valuable feedback. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.